Hi everybody, welcome to you in the channel of Rifat Khater for Poultry Extension. Today I am going to talk about Newcastle disease, which is considered one of the most dangerous viral disease affecting chickens and turkeys, causing high mortality in the affected birds and drop in egg production in layers. Therefore, it causes huge economic losses. Newcastle disease is a highly contagious viral disease, spreads rapidly, affects chickens and turkeys, causing high mortality and decrease the growth ratio in broilers and raising chicks. Also, it causes a drop in egg production in case of affecting layers. Therefore, it causes a huge economic losses. Waterfowls such as ducks and geese resist infection, but they carry the virus without appearing symptoms. Therefore, they transmit infections to chickens and turkeys. Etiology. The causative virus is one of the paramyxoviruses which have one nucleic acid RNA. There are three strains of these viruses. Lentogenic strain. This strain don't cause clinical signs. Therefore, its viruses are used for vaccinating birds, such as Hitchner and Lasota. Mesogenic strain. This strain may cause mild clinical signs. Therefore, its viruses are used for making vaccines such as Kamarov and Roakin. Velogenic strains. This strain causes high mortality. It includes three types according to the affected organ of bird's body. Viscerotropic NDV. NDV affects intestinal tract, especially duodenum and proventriculus. This virus is considered the most velogenic because it causes birds' death without clear signs in cause of acute infection. Pneumotropic NDV. NDV affects larynx, trachea, and other parts of the respiratory system, causing respiratory disturbances in case of subacute and mild infection. Neurotropic NDV. NDV affects the nervous system, causing the nervous clinical signs characterize the Newcastle disease in case of acute and subacute infection. Transmission. The affected birds secrete the virulent virus with droppings and nasal discharge during and after the disease period for 1 month. The infection is transmitted from bird to bird inside the affected house by air, feeds, drinking water, and workers. Also, the infection is transmitted between farms by the route of air, feed trucks, contaminated equipments, visitors, wild birds, and rats. Clinical signs. Clinical signs in chicks and growing birds. 1. Feed consumption decreased to about 20% from normal consumption. The affected chicks are seen huddled beside house walls and around heat sources. The affected birds have ruffled feathers, greenish diarrhea, and respiratory distress, gasping, coughing, and rales. In case of viscerotropic infection, the clinical signs are listless, eye inflammation, and nasal discharges. Then the affected chicks lie on the litter and die through little period. 5. The nervous symptoms appear after respiratory symptoms as follows: paralysis of legs, torticollis, twisted necks, muscular tremors and circular movements, The affected chicks die after appearing the clinical signs directly. Mortality ratio from 5 to 10%, depending on virus virulence, chicks' immunity, and health. The mortality continue 7 to 10 days and arrive to the top mortality in the third day, then decrease gradually. Clinical signs in adult birds. 1. Egg production decreasing to 20 to 50%. The affected hens lay small eggs, many of them misshaped or with thin shells or without shells. 2. If the affected hens were not vaccinated against Newcastle disease, the respiratory signs will be severe, while they will be mild in case of vaccination. 3. At the end of disease period, egg production remain low for 4 to 8 weeks, then increase gradually, but it doesn't arrive to the standard ratio. 4. Mortality ratio of the affected hens arrive to 5 to 20% during disease period, then it decreases gradually after recovering, but it doesn't return to the natural ratio because of secondary bacterial infection. Gross lesion. Severe inflammation in trachea and larynx with mucus secretions in the trachea. 2. Hemorrhagic spots on the intestinal wall, especially in the duodenum area if the infection was with viscerotropic NDV. 3. In the late cases, hemorrhages are seen on the glands of the proventriculus, and we see inflammation in the cecal tonsils. 4. Cloudy air sacs with thickened membranes. 5. Hemorrhagic and necrotic ovaries and ruptured yolks in the peritoneal cavity in the affected hens. Prevention. Broilers chicks vaccinating program. There are various programs in Egypt at the present time because of the epidemic situation of Newcastle disease is different between the governorates of Egypt. But I use the following program in my farm successfully. 1. At the age of 7 days, HNRB1 in drinking water. 2. At the age of 10 to 11 days, ND vaccine IM injection. 3. At the age of 18 days, Clone 30 vaccine in drinking water. 4. At the age of 28 days, vaccinating with Clone 30 or Lasota in drinking water. Vaccinating program of raising chicks of layers. 1. At the age of 7 days, HNRB1 vaccine eye drops or in drinking water. 2. At the age of 10 to 11 days, ND vaccine SC injection. 3. At the age of 18 days, Clone 30 vaccine eye drops or in drinking water. 4. At the age of 28 days, Clone 30 or Lasota vaccine in drinking water. 5. At the age of 6 weeks, ND vaccine SC or IM injection. 6. At the age of 12 weeks, Lasota vaccine in drinking water. 7. At the age of 16 to 18 weeks, ND vaccine IM injection. It's recommended to revaccinate the layers flock with Lasota in drinking water every 2 months to activate the immunity. Finally, thanks so much for watching. Don't forget to press subscribe, like, and share. If you have any inquiry related to this video, please comment and I'll reply with suitable answer. I'll see you in the